what you should remember, when you should remember that when you measure the lateral ventricle, is to measure the lateral ventricle in only the lateral ventricle and not to put the calipers inside the brain like here or here, but you should measure it from actually the true lateral ventricle from one side to the other. Set one, okay, is something like that. Also, it's important when you measure the lateral ventricle not to measure the lateral ventricle in a diagonal fashion like that, because you will have larger measurements, and in a lot of cases you have a normal ones. Now, when you are looking at the transventricular plane, you should be aware of this structure here. Okay, this is 21 weeks. They are not not yet formed, but what you see here is the beginning of the parieto-occipital fissure. Okay, and it's a very good, fantastic index that this fetus most probably will not be lissencephalic. This trapezoid or diamond shape has been described by the group of Ant Stoy in Toronto, and it takes a few seconds to visualize this zone and know that this fetus most probably will not have a lissencephaly. At the same time, if you are looking for the sulci, you see here a normal form Sylvian fissure. You should remember that there are two limitations from the transabdominal approach. One of the limitations is that you are not able to see nicely the midline structures, including the corpus callosum and the vermis, and the vermis of the cerebellum, and also that the proximal hemisphere is usually blurred because of the presence of the parietal bone. We make our approach and we try to look at each of the sutures of the brain. Here you have the coronal one, okay, a little bit posterior you have the lumboid one in one side, in the other. I will try to show you later on the metopic fissure. Now let's go the metopic suture. So we have the first cut is the transventricular. We go to the transthalamic. This is the place where we usually measure the lateral, the BPD and the head circumference. Okay. Again, so here you measure the BPD. I am sure that you know how to do that. I have having a little bit help with the machine because I am not used to work with this machine set. Okay, and we have the head circumference. Okay, I don't need to show you how to do that. Okay, the head circumference. And the third plane will be the plane where we are able to visualize in the same plane the cerebellum and the presence of the cavum septum pellucidum. Here I am showing the fornixes, and here is the cavum septum pellucidum. The cavum septum pellucidum is here, and here's the place where we are going to measure also the TCD. From the axial planes, we may try to obtain coronal ones or sagittal ones. The fetus now is looking up, so we will try to show you the mid-sagittal plane. Usually you need to use the other hand to fix the fetus, and here you have the presence of the corpus callosum, okay, that is here. It's hypoechogenic as expected, and you will be able also, if you want, or you need, you may measure the length of the corpus callosum. There are tables that from these tables you can determine the sex, the fetal age, the gestational week, or to know if the size of the corpus callosum is normal. I think it's very important to remember that in each examination you perform, you should measure at least one of the lateral ventricles as we measure. I do not propose to measure both of them because when you measure both of them, in 30% of the case, you have some kind of asymmetry that is absolutely normal. So what I usually do is to take an image, a picture of the proximal lateral ventricle to show that it's there and it's normal. Again, you should measure the transcerebral diameter, as I showed you before. And also I like to have a measurement recorded of the cisterna magna. The size of cisterna magna should be somewhere between 2 and bigger than 2 and smaller than 10 millimeters. But actually, if you have a measurement bigger than 10 millimeters, what you should do, first of all, is to try to measure the smallest one, because a lot of times you are in a diagonal plane or in an almost coronal plane, and you may measure whatever. So change the plane, obtain the correct plane, measure the smallest cisterna magna size, and usually it will be no problem to do that. If you look at the brain and you're doing a neurosonographic examination, I think that it's very important in any case that you perform this examination to look at the eyes, okay, and at least observe both orbits and the lenses that are there. At 21 weeks, it will be quite difficult to show the optic nerve in the retrobulbar aspect of the eye, because the fat, the retrobulbar fat, that is this triangle here, is of the same echogenicity of the optic nerve. As pregnancy evolves, you will be able to see much better the optic nerve moving inside the fat, because the fat turns to be echogenic, more echogenic. Now, here you can see this black line. This black line is the metopic suture, okay, that is nicely demonstrated and is open. And this is, as I will show you later on in one of my lectures, is why we are able to see the brain in the sagittal plane, because if the sutures are closed, you will not be able to see inside the brain. Now I will try to show you coronal images. This is an anterior coronal plane where you see both lateral ventricles, the corpus callosum and the cavum septum pellucidum in the middle. Okay, you may go from very anterior to posterior. And it's important also to look at the vermis in the coronal plane, because the vermis is usually more echogenic than the hemispheres. So you see that this some hyperechogenic zone in between the hemispheres, you know that the vermis is present. Again, using my hand, I will try to demonstrate the corpus callosum. Usually when you perform a live examination and you have not access to the vaginal one, it will be quite difficult. The fetus will not let you be brilliant and show how easy it is to show the corpus callosum. And since I knew that, I prepared the images. I took images before that. We'll be able to show what we recorded. Okay, as you I hope I recorded it. Let's see. No, it's before, should be here. Okay, set. Okay, as you see the image number 2 and 3, I was aware that it will be difficult to show the corpus callosum, so I recorded the corpus callosum. An early image will be the next one. So let's see. Okay, and here you can see quite nicely the corpus callosum. I show you also before that it's possible to measure it. But it's very interesting that with the transabdominal approach, it's always quite easy to show the presence of the normal vermis. It's early in pregnancy, so to demonstrate the fissures is a little bit more difficult. Nasal bone and a very nice profile. And to finish, I will try to go to the spine and show you the fetus is with the abdomen up, okay? But what you should do if you want to demonstrate the spine is to go to one side, okay? busculate a little bit the fetus. I don't want to busculate very much. So again, I have the images showing you the presence. You see the presence of the normal conus medullaris that ends usually ventral to the spinal canal and at the level of L2 or L2, L3 at this time of pregnancy. But I don't use to count one after the other because you are never sure that you count correctly. So I think I look at the conus medullaris, and the conus medullaris is positioned ventral and not dorsal. You know that it's almost surely there is no neural tube defect, not an open one and not a closed one. If there is any question, I will be happy to answer. Again, here you see very nicely, again, something is important. You see it much better in the transvaginal approach is the presence of a triangular fourth ventricle that ends at the zone of the fastigum. It's not a quadrangular one. If you see a quadrangular one, you may be quite sure there is some kind of pathology. This fourth ventricle should have a triangular shape.
Is there any particular question of wish that's structures that you would like to be demonstrated by Gustavo?
Okay, now look here. I think I have a not bad image of the optic nerve. Let's make it bigger. What you see here, the triangular fat, and the optic nerve is this black zone here. You should recognize the optic nerve because it moves as the eye moves. Actually, what we show is not the optic nerve, but is what's called the optic nerve sheet that includes CSF, the nerve, and the optic artery and the optic vein.
So, Gustavo, this fetus is 21 weeks, and in order to judge the maturation of the fissures and of the sulci, so you would recommend at this stage to stick to the Sylvian fissure and to the beginning of the pareto-occipital?
Yes. If you have a good developed pareto-occipital fissure for 21 weeks, and the Sylvian fissure at this time should be rounded and quite prominent, you can say at least that this fetus has not a total lissencephaly. It may have partial lissencephaly, may have some zones of lissencephaly, but it has not Miller-Dicker and surely not Walker-Barbour.
And at a later gestational age, what would you look for?
Again, I think at the later gestational age, it's by transabdominal, it becomes more and more difficult, but you should look principally at the Sylvian fissure because the Sylvian fissure has a very particular shape. It changed through pregnancy, and I will be able to show how it changed by ultrasound and also by MR at the Meet the Professor lecture on tomorrow. So we are invited to come in the late afternoon to the lecture. Another important thing to remember, if you have a few seconds, is that the amount of fluid, extraaxial fluid, in the frontal zones of the brain is usually less than in the occipital zone. And this is a lot of times you think that there is a brain atrophy or something like that because you see a lot of fluid in the occipital zone. It's normal. It may even be reach 1 centimeter in length.
One centimeter occipital?
1 centimeter occipital is normal. If you measure it at the level of the foramen of Monro in a coronal plane like here, okay, usually should be less than 5 millimeters. Here we measure it, you see? From here, oops, I am touching always the wrong button, but now, you see? 3.2. This is the place where you should measure in a coronal plane at the level of the foramen of Monro. This is normal, less than 5 millimeters.
Well, thank you very much. You did a great job. And
Okay, thank you, Gustavo. If you can come forward because you're speaking next on this side.
Thank you.
So
Thank you very much.
I'm sorry to report that Dr. Palladini is not here yet. His plane has not arrived. So we are going to skip his presentation and move to Gustavo. Dr. Mellinger is going to talk about pericallosal lipomas may escape visualization during the second trimester scan. No, take your time. Good afternoon.
I see that we have a lot of people here in the lecture, and I am going to show you something that is not big science, but perhaps will help you sometime at some moment of your career not to perform an abortion thinking that something is very wrong because you are not aware. It's only a small point you may remember. So I will speak about pericallosal lipomas. Pericallosal lipomas are, in many cases, are non-entities.